Hello, shout out to all my followers on all social media handles and all those who have subscribed to my YouTube channel, those who are following me on TikTok, those who are following me on Facebook. Shout out to you all. I thank you so much. Okay, keep on following me, keep on liking, and then keep on sharing my educations. Okay, so today in my video, I bring you almighty malaria in pregnancy. So one will ask, is malaria dangerous in pregnancy? My answer is whether in pregnancy or not in pregnancy, malaria is a killer disease. Whether in pregnancy or not pregnancy, malaria is a killer disease. But talking about malaria in pregnancy, malaria reduces a woman's what? Immunity to malaria, which makes her more susceptible to malaria infection and increase her risk of what? Illness. Simple and short. I hope you are following what I just said about what? The or how dangerous malaria is in pregnancy. So, as a brother, as a relative, as a husband, as a sister, as a neighbor to someone, to a pregnant woman around you, how will you know that a pregnant woman in your neighborhood is having malaria? When you see a pregnant woman experiencing chills, fatigue, fever, rapid pulse rate, rapid heart rate, diarrhea, cough, headache, joint pains. All these symptoms, if a pregnant woman around you displays all these symptoms, it should tell you that the woman has gotten malaria infection. Please do not waste your time to rush this pregnant woman to any health center, any health facility around you. Okay? Because I previously said at the beginning of this video that malaria is a killer disease. It's a killer disease. The least time you waste, it will kill the person. So, somebody will ask, do we have types of malaria? Yes, of course, we have types of malaria. And I'll mention four types for you in this video. We have Plasmodium falciparum, we have Plasmodium vivax, we have Plasmodium ovale, and then we have Plasmodium malariae. So these are the types of what? Malaria. And the most dangerous of all these type of malaria is the Plasmodium falciparum. It will kill you. It will not show you any mercy. We are saying that malaria kills. It's a dangerous killer. But we have the types of malaria. And among these types I have mentioned, this Plasmodium falciparum is the most dangerous among the malaria that I have just mentioned. So if you sense any signs and symptoms that I've just mentioned in a pregnant woman around you, please kindly rush her to the hospital. Someone will ask, when a pregnant woman gets malaria infection, does the infection or the malaria affect the baby in utero? Of course, my answer is yes. Baby will get infected. And how will you know if baby has gotten or baby is having some effect as a result of mother getting malaria infection? One, baby may develop fever. Two, baby may be displaying irritability. Three, baby will have breathing problem. Four, baby will be what? Having feeding problem. Five, baby will have what? Anemia. And then six, baby will have enlarged liver and the spleen. Please, I hope you are following my education. If this is your first time knowing that malaria is a killer disease, please kindly watch my video, share. Someone somewhere needs to know about this education on malaria. Most people don't know that malaria kills. In this part of the world, malaria kills almost every day millions. But how would you know if the statistics hasn't been read to you? If you don't go get hold of the statistics to know that malaria is killing, how will you know? So in my video today, I'm educating you that please, initially, someone may be infected with malaria. The person wouldn't know. But please, let me emphasize on this again. I have just mentioned some symptoms of malaria. If you are displaying any of those symptoms, please don't waste any more time. Please, let me say this. Let me shape in this. Someone will say, "I don't have money to go to hospital." It is only in movies we always say that what they'll bring someone as an emergency, then the doctor will be saying that, "Madam, you have to deposit 3,000, 4,000 for treatment to start." But as I started practicing as a health professional, I have not laid my eyes once on a client who has been brought to a health facility and has been asked to pay this amount before treatment starts. When they come in, treatment always starts before payment comes in. So please, those of you always make it a point, use money as care of. Please, don't do it. If you sense any of these symptoms I have just mentioned, you have infected, you have gotten infection of what? Malaria, or you have malaria infection, kindly run to the hospital. I hope you are enjoying my education in this video. Please kindly just don't watch and go away. After watching, like, comment, follow me on my YouTube channel, subscribe. I'm saying well, subscribe to my YouTube channel so that you can get subsequent video that will come or you'll be notified. Please, in my next video, I'll be bringing you how we can prevent malaria prevention, treatment of malaria. What do we do to avoid the infection of malaria? Please, have a good day. Don't just watch and go away. Like as well and share. Have a good